walk on the street and people still go to the gym. So a lot of countries are looking at Sweden and think, what the hell are they doing? It's probably a very complex story and I only have 5 minutes. But I think there are a couple of reasons that I really briefly will go over about, and then talk a little bit about the technology in Sweden. So the first reason for this behavior is politics. So the health agency in Sweden, like other agencies in Sweden, they are totally independent. So they don't get an assignment from the politics at all. So that means that they make their own decisions and politics are following those decisions. So when the government asked to the experts, shall we close the schools? Then the experts say, no, it doesn't really make sense for the youth. It's much better to keep them in the schools. And then the government says, yep, okay, you're the expert, we follow that. So in Sweden, that's a very, very strong movement. You trust the experts. The second reason is immediately, that's like, what is the effect of a lockdown, especially for the economics, but also mentally. So in Sweden, they're very much afraid that the cure is worse than the disease. So complete lockdown will definitely disturb the economics, and that will disturb the whole welfare system. The same for mental health. Let people go out, let them do sports. Then the third thing is really trust, because you only can do this if your people are really following your advices. So in Sweden, there is no law right now. There is just advices. Work from home if you can. Let's protect the elderly, keep the distance, etc. And there's no fee if you don't do it. So currently, right now, around 90% of the Swedes are following this. So it's not like the streets are still full and people are shopping like crazy. That's not the case. Most people are at home, they keep their distance, but there is room to live a life outside of the COVID. So what's the current situation then on technology? So the health agency is looking at all the technology that's around it, and again, they're having their own position. Currently, what they're using is they're using the telecom data from Telia, the biggest telecom operator. So they're getting anonymized and aggregated data, and with that, they're looking at the movement of the people in Sweden and the movement of COVID-19 throughout Sweden. They also use that data right now to see if people are really following the advice of the social distancing. So they're zooming in on parks and they see more movements or not. So they use that as well. On very short notice, what they will release is a website and an app where they ask the Swedish people to fill in information about their health. And then they start to trace that as well. Again, anonymous, it's locally stored, but it's not proximity data. So it's only about in which region people are feeling sick and having symptoms. And then the last thing, and that will take at least a couple of months, that is like the proximity app, or the app that Singapore has and other countries are looking at. So the statement there is they're very much looking at Apple and Google, at the technology that they are building, but there need to be a public discussion and a public debate. And again, this has to do with the mentality of the Swedish people. They really believe in consensus. So they really want to have an open discussion with all the experts, but with other people, with the unions, everybody. And only then they will release such an app. So the prediction is that will be a couple of months away from now. That's about it.
Okay, thank you, John. So So in Korea, we have this high trust in government. In Sweden, we have this high trust in experts. So what if the experts would say, forget about autonomy or privacy, this app is really important? What would the Swedish people do with that trust?
They will download the app and use it.
Yeah?
Yeah, for sure.
Because it's amazing. The way Sweden is acting is a bit like Netherlands, but even more open still.
Yeah.
But so they would have this trust on these experts and say, okay, if you tell me I should use an app, I will do for this consensus reason.
Absolutely.
Yeah. Great, thank you so much, and also for this bigger picture. We're going to move on yet again, fly over the world, and we have some questions for you, but it will come in later. Yep. So thank you so much for your perspective. We're going over all to the world, different states, and that will be Nigel Jacob, who's the CIO of the City of Boston. We had some colleagues of yours present a couple of months ago about a city as a platform. So I'd love to have you back again. I'm very curious how you guys are doing over there in this different part of the world. Please, Nigel, fill us in.
Thanks very much. And thanks for inviting me to this great conversation. It's a delight to be able to connect to my international colleagues. So I wanted to contextualize the situation in Boston. I have to spend a couple of minutes talking about the situation in the US. I've spent a lot of my time talking to other cities across the country, so I have a pretty good sense as to what's going on. In the United States, it's a very different situation as compared to the last two speakers. Americans do not trust their government, especially the federal government. And so the COVID response in many ways has been led by the local level, in many cases by governors. So governors control the states across the United States. And each of them are taking similar but different approaches. Even the timing at which they started to roll out responses differed a great deal. So across the country, we've had closures pretty much everywhere. Some states went kicking and screaming, and we're now at a point where they're beginning to reopen. And there's not a consensus as to when and how that should happen. And frankly, the president is being antagonistic towards governors and to mayors. And so it's a very complicated situation as a result. In the case of Boston, our strategy has largely been informed by focusing on the needs of our most vulnerable residents. So the elderly, children, the homeless, and making sure they have direct support. So we've been distributing lots of meals and so on, and support to small businesses and that sort of thing. On the technology front, again, it's been very broad across the United States. There have been three large efforts that have been going for the past several weeks. There's an effort being led here at MIT called Safe Paths, which is a version of what's been happening in Singapore with an orientation towards radical distribution of the data, right? So the architecture of that system is for individuals to keep their data and then to have a process by which they can share it in a controlled way to be able to do contact tracing. There's also another effort at Stanford University in California called COVID Watch, which both of these efforts are working pretty closely with one another and using the same basic model. We have to design systems in a way where Americans are antagonistic with the federal government. And then lastly, obviously, there is the Google Apple effort, which frankly has not been very transparent as to how they're building things. So a lot of cities around the country are scratching their heads trying to figure out what will it do. You know, basically it's an app or a technology built into the operating systems on phones, and what will it do and what won't it do, and how will that interrelate to what cities are doing? So that's a big question. There's been a lot of national discussion, especially by computer security experts and identity experts, about the ways that this Apple and Google solution could fail, you know, and expose personal data and so on. So that's an ongoing effort, which we don't, frankly, that I've ever seen, that we don't know a lot about at the city level. In the state of Massachusetts, where Boston is based, there has been an effort to create more of a grassroots approach to contact tracing. So it'll be very telephone based. It'll be, you know, the way that they used to do it in the good old days, where we'll be employing young people and homeless people to be able to do contact tracing and following up via phones and so on. So that will, that's being led by the state of Massachusetts. Some of that will be technology based, but a lot of it will be regular phones and so on. And that's about all I have.
Well, great. I would have two observations or questions for you. The last one I like about this grassroots, for at least in the Netherlands. One problem might be that if we are going to use this app and in case lots of people would go and start using this app, we also need a lot of healthcare people dealing with the data of the app. So where do we get these people? So that might just even be these young people of people out of jobs who could regain a job again. So that could be a nice combination. Mm-hmm. So this was an observation for me. But I had a question for you, because you also told us about how at least the city of Boston is trying to put their effort to these very vulnerable people. Mm-hmm. How could an app, which is a tracing app, so it only traces when you already have been in contact with people who have COVID, how do you think could this app be of help for these very vulnerable people? Any idea?
I think, you know, our homeless population is a very mobile population. So during the course of a day, they make their way across the city. And so I think it could certainly be used to understand where those people are going. But frankly, we haven't, like in Sweden, we haven't passed a lot of laws in Boston. It's mostly been a series of recommendations to stay in place. And so our streets are empty for the most part. It would be hard to say. I'm not sure how much more intelligence an app could give us versus what we're seeing right now. So it's a good question. That's unclear.
Great, and it's still great that you question that there's no answer yet. Well, maybe it will come in this hour, maybe in the weeks to come. But thank you so much for your perspective and these empty streets. So sorry for that. We're going to go over again a bit closer to you now, to the north, to Canada. So please welcome then Glikstein from Montreal. You are a researcher and have looked to Montreal, but also have a more international perspective already. So the floor is yours now for the next 5 minutes to come. I'm looking forward.
Thank you so much for having me. I'm really honored. The experience in Canada is a little bit between what we've heard of the experience in Europe and a little bit of the experience in the United States. We kind of fall in the middle. At first, we only had recommendations put out by the government. However, on March 23rd, the Prime Minister, Justin Trudeau, said, enough is enough, go home and stay home. And that's when the pandemic response began in earnest, and recommendations changed over into laws and regulations. Because of the Constitution, separating powers between the federal government and the provinces, it is the provinces that are responsible for healthcare. And the federal government is responsible for quarantine measures. So right now, the federal government is helping provinces coordinate. Unlike the experience in the United States, the federal government is helping provinces obtain resources as needed. And what we are experiencing is, on one hand, very severe fines and regulations. And on the other hand, we've got the situation somewhat under control in some areas, and in some other areas, we've got severe problems. I'll get into details in a second. So what we've got right now in Canada, in some areas, because it's a very big country that is sparsely populated, some areas no longer have new infections or have a very slow rate of infection spreading. Other areas, though, have very high rates. We've got the infection that has spread to penitentiaries, prisons, and so the public safety minister quietly released some prisoners in order to spread out non-violent offenders and reduce the rate of infection in prisons because they are a contained space. We've also got infections in meat processing plants, and this is a problem because Alberta is the main producer of beef in the country, and right now 2 of the plants that are closed out of the 3 that are closed are responsible on their own for 70% of the country's beef production. And a lot of that beef, especially the trimmings, go down to the United States to be processed into ground meat. We've also got an outbreak in a chicken processing plant in British Columbia out west. Moreover, we've also got, again, in confined spaces, and this is a little bit more dangerous because it's isolated, we've got oil exploitation that happens in the northern part of Alberta, and there has been a facility that had infection spreading through it, and now the people who went to work at that facility are going back to their home provinces and spreading the infection there. The biggest risk, though, and the biggest concentration of infections is in long-term care homes, so homes for the elderly. Now, these are posing particular challenges to health authorities, and in British Columbia, the government is attempting to reduce the risk of contamination in these very sensitive facilities by restricting movement of staff by law. Saskatchewan, another province, is enacting similar measures. But other provinces, like the province of Quebec and the province of Ontario, are having much more trouble containing the outbreaks. And so the province of Quebec just requested 1,000 soldiers from the federal government to assist in these long-term care homes, where about 1,200 care staff are already infected and unable to work. Similarly, the province of Ontario is requesting military assistance. What's interesting is that half the deaths in Canada come from these long-term care facilities. And so that even led to some politicians, like the British Columbia Conservative Member of Parliament, Mark Dalton, suggesting that since most deaths are in these long-term care homes, why don't we move Canada back to work? However, his tweet was quickly deleted because it caused minor uproar. Nevertheless, a lot of provincial authorities, so premiers, are very hopeful that they can lift restrictions soon and at least start partially reopening their economies. However, they are leaning more towards the question of health rather than economics, unlike perhaps some of the governors of our southern neighbors. The Chief Public Health Officer of Canada, Dr. Tam, clearly stated that the absolute key is having sensitive systems to detect any new cases and to do rigorous contact tracing around those cases. Now, contact tracing in the manual way is very labor intensive. And so governments are, at all levels, are looking at technological solutions. There is an app that was developed by Thrive Health, and it's not a proximity tracing app, but it does track symptoms. And it looks like this. So it requests people to input their symptoms and to input their postal code, and it collects geolocation with permission. Now, it also provides information on social distancing and what to do if one falls ill, but it seems that there is less than 200,000 downloads of this application provided by Health Canada, the Ministry of Health of the country. The province of Ontario has revealed that it will be developing a contact tracing application with a third party, but it hasn't revealed which company. And the city of Ottawa is also desirous of launching a contact tracing application, also developed by a third party in the next few days. the Minister of Innovation, Science and Industry said that with respect to contact tracing, if the country moves forward into that direction, we need to deal with privacy in a meaningful way. And that's actually something that the Canadian Civil Liberties Association, represented by Miss Brenda McPhail, has really stressed the importance of necessary surveillance and not to exceed bounds in data collection. Furthermore, the Office of the Privacy Commissioner of Canada has published a guide for government institutions to balance individual privacy and public health with 9 principles, which are meant really to preserve the privacy of citizens and make sure that any data that is collected is done so on a necessary basis. There are a number of companies trying to get into contact tracing. And if you'd like me to go into these details, I will, but I think I'm out of time. So that's the situation in Canada. Thank you.
You are. If someone else is going to ask you a question, then we can go back to these details, which I would love to hear as well. But but thank you so much for taking us all the way from recommendations to regulations and this huge diversity within your country on these regions and how this is acting and mostly these care homes, which is the same problem we have in the Netherlands. What struck me in your presentation was all these cities are using or developing their own apps. Did I get that right?
So it's not all these cities. There's one city who said that they would like to develop their app. There's a province that said they would like to develop their app, and they're for contact tracing. The federal government has developed an app for symptom tracing, somewhat like what Mr. John Dekker was telling us in Sweden. And the province of British Columbia has also released an app like that. The cities themselves are not developing apps as on their own. The city of Ottawa has, however, mentioned that they want to release an app, but developed by a third party. Okay, great. Thank you for clearing that up to me. But still some different levels and different innovations at the same time. Please stay with us, and I hope in the end we can get to some more details as well. And thank you so much already. So now we're going to have a bit of a broader perspective, and we're going to jump into the Netherlands. And still, I'm so happy to have all these different views from different countries with different coming from, different characteristics. But please join us now, Tom Demeyer. He's Chief Technology Officer from the Waag. And he's going to use a small presentation and take us in also how we could embrace technology for a better world, for maybe a safer world, but still very carefully, of course. And please, Tom, I asked you before, also tell us a bit about what happened last weekend here in the Netherlands with this Epiphone. The floor is yours.
Thank you, Leonie. Yes, now I will mainly talk about the last 2 weeks where the Epiphone was taking place. The situation in the Netherlands is a little bit like Sweden, but slightly more strict, because we have closed restaurants, we have closed gyms. Everything where people are really close together is closed, but we're not locked down. So what our government likes to call an intelligent lockdown. In order to be able to do this source and contact research that the health authorities are doing, they feel that they don't have the capacity to do this properly. So there was a request made for looking into an app to assist them with contact tracing. We've been through 2 weeks of total unprecedented public discussion, which you'll find very interesting for Sweden when you are going to have that public discussion eventually. Public discussion about ICT, tender ICT ideas with no precedent. I can share the chronology of that process with you through the chat channel. I will not block my screen doing that. It's probably better for me to just go through it quickly. The minister, when was it? April 7th, it was announced that they were looking to aid the health authorities in the contact research with looking into an app. That was, of course, without solid evidence of any of these apps really working. And there was the product owner of the app in Singapore had just published a quite critical report about the effectiveness of these apps. Some of the privacy and data protection civic platforms in the Netherlands, Waag is one of them, Bits of Freedom is another, the Platform for Civic Rights is another. They came together because the narrative in the news was, oh, are we prepared to sacrifice a little bit of privacy for our health? And this, of course, everybody said, sure, yeah, why not? Health is very important. But no news agency, no news reporter was smart enough to wonder whether this was an actual dilemma, which it is not. You can have both. You can have solid contact tracing, if it's possible, and privacy. And so we made a manifesto. It's Safe Against Corona.nl. You can find it in English there. Veilig tegen corona.nl in Dutch, where we shared 10 points with the government. Fine, we are willing to consider this from a privacy and data protection standpoint once you have looked at these criteria, and they are fairly normal criteria. We need to have a scientific basis for doing this. It has to be temporary. We don't want centralized storage of data. Those sorts of things are quite, in our opinion, quite normal considerations. That's all well and good. The government, it wasn't a proper tender, but they invited companies and organizations to come with ideas. The parliament got into the game, asking some critical questions about this process. 140 academics, we call it the professor letter, sent an open letter to the government expressing the same concerns as we did in Safe Against Corona. Don't worry, I'll share these, the chronology with you later. And on Saturday, the 11th of April, the tender or the question was published, and the 14th of April, the deadline was, the entries were closed. So people had 3 days to come up with something, which is quite amazing. It was such a rush job that everybody was stretching behind their ears and wondering what they were going to get themselves into. In any case, there were 700 entries nonetheless, which is amazing given the limited time. And they were filtered through some, still, I don't know what criteria they used for this filtering, but they were reduced to 67. To 67 entries, which experts could further filter. I was one of those experts. And after a day of filtering, where we had 2 batches of 6 proposals, which had already made it through the first consultation, we had 2 batches of 6 proposals in which we found 0 serious enough ones, which took everything into consideration. Later that day, some of us decided to pull back out of the process. It was just too quick and too fast. 7 solutions were subsequently presented the next day. And Saturday and Sunday, there was a huge public discussion, which is a really interesting process. Some 100 experts all over the country on legal aspects, on social, on philosophical aspects, on technical aspects, and on epidemiological aspects. They were all participating in this public development of these 7 apps towards something that could be, that could actually help, that could actually work. And the process was so incredible that we have quite a positive impression from the whole process, even though the conclusion has to be that an app that automatically tracks contacts is wishful thinking. We do believe digital aids are possible still, that is possible, but automatically tracking contacts through Bluetooth is just a dead-end street. There's too many risks of false positives. There's too much risk of overloading the health authorities with work that we have to conclude that such an app automatically is not going to work. That is a bit, there's many more conclusions, of course. As I said, I will share the presentation. That is what happened. One of the most positive aspects of it is that this provides an insight in how a public consultation might work. I don't know about other countries, but public ICT is more failure than success in the Netherlands. Every big ICT project is a disaster. If you would use the same mechanisms as we have used here in this case, I'm sure, and many with me, that we would have a much better chance of providing efficient ICT designs and ICT deployments. I think that those are the main points. I will drop the file in the chat for you to peruse.
Okay.
Open to questions.
Yeah, Tom, thank you so much. What I loved about your talk is lots of people were very skeptical about this epiphone process and the speed of it. But that at the end of the day, lots has gone wrong, but there's still some benefits. And I think, well, it has great things as well. But I would love to hear only one question for you. And then we're going to go to the questions in the chat box. And Cornelia is lining up already. But you said, when we're going to use these apps, like I said at the beginning, whatever technology is in place, it needs to have people first. So it could be the citizen, but also the health practitioner. So, and you mentioned this health practitioner. And you got the feeling that these apps will not help them, but it will overload them with work, whilst the intention of these apps would be having them have less work. So could you please give 1 or 2 sentences why this app would not be helpful for them?
Well, the main reason is the risk of false positives, where one thing that was recognized immediately, that self-reporting was out of the question.
Okay.
So you would first have to be diagnosed positive before you would be able to get a token that would allow you to trigger the response. But then you would still have the idea that false positives, for instance, through a wall, where you, or those sorts of things would trigger too much work from the health authorities. The other thing, of course, is that these apps require Bluetooth, which is a minimum of version 4, and the people most at risk are, of course, the elderly and the people who generally have less sophisticated telephones. So that was also an aspect of it. And there were many more of them, which led you to not believe in these solutions. Of course, they can help when you don't do it automatically. When you're involved as a person in dealing with the app, self-reporting is still out of the question, but you can at least have an idea that you could wave to each other in a digital way, but make it an active process, okay, which would then have the same effect.
Thank you. We're running out of time a bit. We always do at Data Dilemmas over here, and people stay always for the drinks afterwards. So normally it's not a big issue. I hope everyone will bear with me for a bit like 5:05, mostly, because still lots of people present and still from all over the world. So thank you for that. Cornelia, could you please have a few questions who came in the chat box? We can go in that, and then I will have this final question for the speakers. So that's going to need some 5 minutes as well. Please, speakers, also prepare for that. What have you learned, and what would you share with the community about that in 1 sentence? But first, Cornelia, could you have some questions, please?
Sure. So there were a couple of questions for John. The first one is about the actual situation in Sweden compared to other countries. So can you briefly reflect on whether there's more cases and deaths in Sweden, probably per capita, compared to countries that have more strict lockdowns?
Well, the number is around 20,000 infected, but 2,000 dead currently. 900 women, 1,100 men. That's pretty high compared to the neighboring countries like Finland and Norwegian, etc. One of the reasons is that we don't have the lockdown. So Sweden accepts that the virus will go around and it will travel through the country. So Sweden accepts that the weak people, they die right now. So they focus completely on preventing that and giving all the aid to the vulnerable people. So they think that they are over the peak now, and that the countries around us, once they open again after the lockdown, their numbers will increase.
And I think I also read that you're expecting then to reach herd immunity in a few weeks. Is that, that's quite a controversial discussion in some places. Maybe you can briefly comment on that as well.
Yeah, not a few weeks, probably longer. Everything takes longer, a couple of months probably. But this is, yeah, you're correct. This is one of the strategies that the experts here say it will travel through the country. It will travel also across the borders. So it doesn't stop at the border. So let it go around, but then focus on protecting the vulnerable and take action there. And then the second thing is of course, make sure that the healthcare systems can deal with it, that you have enough emergency beds in the hospital. And right now, it's always under 20% buffer in Sweden. So that's the strategy.
Mm-hmm. John, one more question for you.
Yep.
And that's about what do Swedish people think about mobility location data from cell phones used? So is that at all controversial, or is that, how can you comment on that?
No, not the cell phone, because that is anonymized and they don't even know that they're doing that. And they're doing that anyway for public transport information. Where shall they open the next bus stop, etc. The controversial is obviously in the proximity app using the Bluetooth. And the reason why I answered Leonie before that I believe that the Swedish people will download the app once it's approved is because it's very doubtful that it ever will be approved, because they're very skeptical about the privacy, but also everybody needs to agree on it. So that's going to take a long, long time. So it's very doubtful that this will ever be released here. And then I saw one comment as well, very quickly in the chat about Apple and Google. I realized that they're not building apps, but one of the points that they're making here constantly is like the virus is not stopping at the border. So even if you have this proximity app and everybody in Sweden is using it, at a certain moment it will travel through Europe again. So isn't it better to look at a platform that is global?
Yeah.
Great, thanks, John. So then I think maybe also continuing on a comment from Hoos Andrews. Maybe actually if Hoos is still around, then maybe I will let you maybe.
I am here. It's pronounced Gus, but yes, hi.
Sorry, Gus. Sorry, my bad. Did you want to maybe expand a little bit on your comment about antibody status?
Yeah, so we've had a lot of people here proposing, like when I was in a conversation yesterday with a number of very large organizations in the United States, some of whom you would not want to be involved in contact tracing. And there were some people were sort of positing, oh, hey, you know, there's the app that tracks does contact tracing. There's an app that might say like, you have the antibodies, you're free to go back to work. There's an app that does education. So some people were starting to talk about these as if they were all the same app. But I think it's worth keeping in mind that like, you don't need to have just one COVID app. It might be actually more privacy protecting not to do that and to make them separate. But then you run into problems generally. I mean, we run into problems generally of proliferation of apps. That's a big concern right now is if New York City, New Jersey, and Connecticut are building their own app, as the speaker just said a second ago. And, you know, there are borders, you know, like people cross borders all the time. And then, you know, Google and Apple have opened up their API so anybody can make stuff. how do we, as a community concerned with privacy, identify which app we believe is the most privacy protecting and notify people, let them know that this is the one that we find safest. Somebody said to me earlier today, this is the reason I'm here, somebody said, you know, well, contact tracing isn't safe. It's not worth the risk to privacy. And I was like, unfortunately, in New York City, we're at the point of harm reduction. Our governor has already said that he is going to build these apps. And so we need to just make the case that we need to do it in a way that's better.
Thanks so much for the comment. I think it's very relevant. I think, Tom, you wanted to maybe briefly respond to that from the Dutch perspective?
Yeah, the DP3T protocol that has been recommended here in Europe quite often is actually very privacy friendly. There is no way you can leak data through that, and that is the protocol that Google and Apple are going to use. So I'm actually quite positive about their initiative. The problem with Google and Apple, of course, is that we are putting all our eggs in one basket again, because we're already depending on them for the app stores and the operating systems and the devices. But it is actually a very privacy preserving solution that they present. So the discussion should be a little bit more nuanced when they're in the picture, I think.
And Tom, I think there's actually been so much interest in the whole topic, and also the DP3T at one point was hoping to participate, but it came in a little bit late. So we might just have to organize a follow-up discussion on this. Yeah. But in the meanwhile, and again, apologies, we couldn't answer all the questions, but it looks like in the chat box, there are people already answering each other's questions. So I think I just have to give the floor back to Leonie, and I think we have to wrap it up in the next 5 minutes.
Thank you, Cornelia, and I will wrap up. And we talked about this before, how much time we'd love to have this talk for 2 hours maybe, but it's way too long for a webinar. So that's why we needed to serve all around the world. And maybe just briefly, I hope some people got in contact and might be able by LinkedIn or whatever to keep having this interaction, because it does not have to be only here today. I wanted to make this wrap up, and I announced this question already. So we have talked about technology as a means to restart our societies again. And we looked into the possibilities of an app. And we have seen that lots of people are having these great doubts about app, maybe because of privacy, which might be even able to find a solution, but also about usability. How do we use it safely and for not having these false positives like Tom said. So here it is, our last question. If not apps, then maybe some other technology might be of help, tracking people, crowd monitoring, whatever. Other technology might be of help of restarting our societies. Tom, what have you learned? And then I go back from Tom to etc. What have you learned in one sentence, which you would love to give back to the audience and take along with you, whatever new technology will come in place for you?
I think my main takeaway would be that when you carefully look at technical propositions, you suddenly realize that you haven't really looked at all the analog propositions that are also still possible. We've heard so many arguments for so many different ways of solving that problem, which don't involve non-functional apps or bad apps, that is what I've learned. Look at the analog solutions and see what you can. And you might be able to enhance your analog solutions with a digital aid, like a notebook type thing, or there's no reason to discount technology altogether, but keep looking at the analog things.
Thank you. Have this open mind and be curious. Nigel, what would be your takeout, which you would like to share with us?
I would give a +1 to Tom's position. I agree. We should not ignore analog solutions. You know, the thing, you know, and I am fascinated by the whole appathon idea. You know, I think there's a lot. I think what I would do over again if we had the chance would be to have more technological training of a sort, you know, both in the public sector and in the public. You know, I think increasingly technology discussions has to be part of civic dialogue. It's not just about, you know, the skills of civic activity now must include technological understanding. So having that spread more widely would be my key takeaway.
Okay, thank you so much. for the +1 and the new ideas. Then I go over to John. What would be your takeaway?
I think I agree with Tom, and if you throw bad technology at people, they won't use it, and it's just counterproductive. And I think the lesson is that also from the Hackathon in the Netherlands is that it's a process. You have to go through all the motions, and you have to make sure that it's from bottom up, it's supported. And only then I would say that you really have a chance for digital solutions. Because in a democracy, you cannot enforce an app or any digital solution. That's not possible.
Thank you. And then I'm going over to Miriam, and Dan, you will be our final one. I skipped you. I'm sorry for that, but I'm going to first to Miriam and then to Dan. And thank you. Miriam, what would be your takeaway?
I'm sorry. I'm a little bit worried because many countries are using applications developed by private sector. In the case of Korea, all the data are encrypted and storage in the database of the government. So this is to manage information and is very safe. And also, it's not only for anyone using this application. This application of the Korea are using for people who's coming from another country and arrive in the airport, and they put in quarantine 14 days, and they have to report by this application and monitoring their movement in real time. This is for complying the quarantine, for safety of all people, all citizens. And the other thing is very important is in the beginning, when someone has some symptoms or have positive, there is an interview first, and then the government asks to this citizen if they are agreed to research the information in the government database. And there is another database, big platform using big data and of the 28 government institutions. So the epidemiological surveys, normally it took 1 day. But
Miriam,
after
Miriam, I'm sorry, I have to.
I'm sorry. Yes. After using this, it took only 10 minutes, and reducing the time is very, very important in this kind of pandemic situation.
Yeah. But you made a strong point of having this government put your trust in it. It should not be of the private sector, but of the governmental sector. I heard you say. So thank you for that perspective. It had not been in place yet. And then finally, Dan, one sentence of you, what would be your takeaway, which you would like to share with the audience?
Thank you. I would say that the main issue is adoption. Privacy is just one dimension of the adoption problem. As John mentioned, we can't have governments impose this in liberal democratic societies. We need to have people want to use any sort of solution that we propose.
Okay, great. That's a great lineup, or at least I did lose you. People, it's about 7 minutes past 5. I loved, for me at least, I love to have this talk and have all these different perspectives, and very much so even these learnings at the end. Keep your broad perspective on everything. So I would like just to close up this session, which to me was really interesting. I would love to wish you a very nice day or evening or morning, whatever you are on this world. Stay safe and take care for yourself and for your loved ones, and even the people you don't love, don't know, but are approximate of you, and hopefully for better times. Have a great day. Thank you so much. Bye.
Thanks, everybody.